in the state of Connecticut. You know, as you can see, it's right there in the middle, the number 3. Local health departments in Connecticut can be either full-time, district, or part-time departments. Okay. I thought I was hearing that.
Still.
So our central office and our clinical offices are in Rocky Hill, 2080 Southstein Highway for our main office. And then we have our clinical services offices on Cromwell Avenue. We currently have 16 employees. Several of those are grant funded, and that right now is kind of an issue. We have over 50 active professional and lay volunteers that are involved in our organization that help us do a variety of things like contact tracing, help us do things like vaccination clinics, which we'll talk about later in the presentation. We have an oversight from a 14-member board of health, and that's made up of board members appointed by you guys. So three from Berlin, 4 from Newington, 2 of which actually 3 of which I have here with me today. So Geraldine Nagel, Bill McCarthy, and Dave Wimet. Unfortunately, Paula Siegel, who is our newest board member, could not make it tonight, unfortunately. But I'm happy to have these folks who are your representatives on our board here to join us tonight. So let's talk a little bit about the bottom line. So our most recent audit for the 23-24 fiscal year showed our revenues at a little bit over $1.8 million. Used to be that the biggest contribution that we saw was from the towns, and that changed a little bit during COVID. And we're at the end of that point where that COVID funding is really running out. So you see that the town contributions during that year were at $7.75 per person. We got some program revenue, and that program revenue is generally from things like our flu clinics, things like our license and fees for when we actually do license, food establishments, pools, motels, salons, barbershops, those types of things. And then we have grants that at this point was the most amount of money that we actually saw in revenue came from grants. A lot of that was federal pass-through of COVID dollars that were coming through, in addition to block grants and things of that nature. We get a little bit of interest income from money that we have in reserve, but it's usually not that much. Our expenditures are kind of what you'd expect from our organization. So we don't make widgets. We provide services, and we have professional staff that provide that. So the majority of expenditures that we have really go to the salary and benefits for those people, the 16 employees that we have. We have some professional contracts at about $58,000, and our program and operating expenses at about $223,000. So really, what's the purpose of a public health agency? Wouldn't it be great to go to the pharmacy and order an ounce of prevention? We can't do that. So we have to spend a lot of our time doing those 3 Ps that we talked about kind of at the front of the presentation. So preventing epidemics, protecting against environmental hazards, preventing injuries. We spend a lot of our time promoting and encouraging healthy behaviors, making people aware and educated so that they can be healthy in their homes and their families, responding to disasters and assisting our communities in recoveries from those. And we also assure the quality and accessibility of health services. So just a quick run through from things so that people are familiar with healthcare, and public health is similar to that, but it's a little bit different. So in healthcare, the primary focus is the individual. They're ill, they need some treatment. Where public health, we look at the population as a whole, as our patient. The intervention for healthcare is really to diagnose and treat that particular malady, where we really look to do 3 things. We assess, we develop policies based on those assessments, and then we assure that those policies are followed and carried out. The process for healthcare really looks at management of patient care, where in public health, we look more at systems management, things like how we can, assure a healthy environment and how we can assure that human behavior doesn't impact them. The outcome with healthcare is really to return the individual to health, where in public health, we look at trying to sustain and assure a healthy community overall. So here in the past couple few years, we've seen some changes in the 10 essential services of public health at the national level. In the past, you see that assessment, policy development, and assurance really encompasses everything that we do. It's the backbone of those 10 services. They've changed the focus at the center where they've had it at research in the past. Now it's equity to assure that everybody has the opportunity to be healthy. In addition, they added one other thing that was build and maintain a strong organizational infrastructure for public health as one of the essential functions for what we do. So let's talk a little bit about the fun stuff. So the epidemiology. Every week I send off the weekly epidemiology report. Do you guys get that?
Yes.
Yeah, if you don't get it, go to our website. It's good information. We have an epidemiologist on staff. We've had her on staff for a couple of years now. And their job is really to track the data, to look at what trends are out there, to what we're actually seeing rise. And here recently, influenza has been the name of the game. We're starting to see those numbers come down now. But as things go down, other things come up. So influenza A is on the decline, influenza B is rising because it's springtime and that generally happens. Epidemiologists are very important to be able to look at data from hospitals, from providers, and to be able to provide an opportunity for us to use that data in ways that we can enact policy. So looking at that data surveillance, the epidemiology is really important, especially for respiratory viruses. Measles, as Mitch mentioned, was very top of mind here recently. We've seen a major outbreak here in the country with respect to measles. But other respiratory viruses are also things that we keep an eye on, sexually transmitted infections, to also include things like opioids and mental health. We're tracking data on overdose within the 4 towns, and our epidemiologist is helping to analyze that data. In addition, we do foodborne illness tracking, tick-borne illness tracking. We've been working with our school nurse supervisors very closely over the last several years since COVID to make sure that we share information back and forth. Because as you know, our tiny little vectors of disease, as we call our kids, they can like to share a lot of things. And usually schools are a good way to pick up on the health of the community overall. So having that connection with the school nurses has really been important. In addition, our epidemiologist works with regional and statewide local epidemiologists to make sure that we're approaching the common problems in a standardized way so that we can share and compare data back and forth, which becomes very important when we're starting to talk about, are our communities as healthy as our neighbors? Here's the backbone of really public health, the foundational element, our environmental health staff. They really are out there every single day. Over 1,500 food service, temporary events, septic pool, motel, hotel, salon inspections annually with 5 staff. So that's a lot of work, folks. And they're out there every single day assuring that the places that we eat and the places that we stay, where we work, are healthy and able to be open and effective. They review plans, permits for things like septic inspections, for septic systems, water supplies, wells. And last year in 2024, we responded to 164 different complaints. A lot of these working with state's attorney's offices, Department of Public Health, but also a lot working with our local social service folks, things like hoarding, housing issues, a lot of rodent issues. I'm sure that you folks have heard that we've been involved in dealing with those situations. And our environmental health staff are really the boots on the ground and really helping to address those issues where they happen. Our community health division, we're coming up here on the first full week of April, and for public health folks, that is Public Health Week. So we have a lot of emphasis on promoting the things that public health does during that week. This year, we actually have something that we've done in the past. We're having a stakeholder forum for around the opioid issue. So we've done that back in, I believe the last time that we brought everybody together was like 2018. So it's been a few years. COVID kind of got in the way of that, but the ability to bring people together is one of the key functions of public health. We become the table to talk about issues with health and bring police, schools, social services, residents, and policymakers to be able to address those issues. We also use things like the block grant to look at things like chronic disease reduction. So several years ago, we had a focus on complete streets, if you're familiar with that concept, where everybody can use the streets for walking, biking, driving, mass transit. And it's a great policy. We brought folks together from all of our communities to be able to learn more about that. From that meeting, we've had, I think, 2 towns that have adopted complete streets as a policy, and they have active bike walk groups that are actively pursuing and engaging the community in being active and healthy in their communities. We also, coming up here in May, we have our 4-town walking competition. Newington's been great with respect to that, but last year Rocky Hill had the trifecta. They won everything that you could win. So they had
take that.
Yeah, I know. You're going to take that. That's my challenge to you folks. Is if you want to have that large trophy with a size 13 gold shoe on top sitting on the mayor's desk, that's really something that you want to engage in. So we've got that 4-town walking competition coming up here in May. They're going to be doing registrations here in the next few weeks in April. So I encourage all of you to be on the lookout for that. It is really a point of pride, I think, for each town to be able to win that. And it's a good way to engage your residents in being healthy, being active. In addition to that, we've used a lot of the grant resources that you saw that come into our agency. We actually put money out. So for our block grant, we actually have funded things like bike repair stations, bike racks, benches within the community so that people are able to use the equipment and be able to use the trails that are available to them within the towns. That's money that we actually put out to you for use within the community. In addition, we do a lot of our vaccination programs. People are familiar with in October when we come out, we do mass vaccinations, and we use our volunteers in this. And we have 3 main goals when we do it. One is to prevent influenza morbidity and mortality, but we also use it to practice for a public health emergency. And this really helped us out when we had COVID, as you know, because we did 38 different mass clinics for COVID during that time frame, using those volunteers that we had trained every year, using the plans that we had developed and tested. So when we came to have to do those vaccinations, it wasn't something new. We weren't training new people. We were just engaging the folks that we already had, and we were able to really effectively deal with that situation. In addition, we also provide revenue for the agency because we do bill insurance companies for those. So it does provide us some revenue in those programs and fees that you saw. So we have new clinical health services. They also provide immunizations, but outside of that month of October, they do influenza vaccinations for kids, adults, and we also do the senior high dose vaccination. They help with the mass vaccinations, but they also look at doing things like regular COVID vaccinations. We've done that at our clinical site. In addition to that, they help to train folks. Did you know that there's a system called CT Wiz where all of your vaccination information is actually stored at the state? So our clinical folks can train you as to how you can gain access to that. So that if you're curious, oh, did I get the pneumococcal vaccine? You can see whether or not you've actually done that. We also do testing, screenings for hepatitis C, and a lot of blood pressure screenings where our clinical staff are going out to places like senior centers and within the community to be able to provide that type of information and screening. As I mentioned, we've had a response to our opioid crisis here for several years. We've been that convener of local response agencies in our towns. We currently have work groups that address prevention, response, and recovery in the Central Connecticut Opioid Coalition. We've had 2 grants that we've actually gotten to do this work, and we actually employ 2 recovery coaches that work within the community in Newington, mostly along the Berlin Turnpike, but also the Silestein and numerous other places. We use data, and the data that we get from OD Map, which is an overdose mapping function. We actually use that data to be able to target areas where our recovery coaches actually spend their time. So it's a very useful function that we've been able to do, and we're continuing to engage. We started this with how can we help? And we're continuing to ask that question. How can we help our communities be able to support recovery within those towns? So how do we prepare for the future? So we currently, our board here in the last year adopted a new strategic plan. As part of that, we did a community health assessment. We continue to do community health improvement planning, and we engaged the community in conversation. So we have had community conversations via Zoom. We are going to continue to do that to try to engage folks, to have them have a say and a part in what we do as an agency to support public health. My last two words, as always, are thank you. Thank you for the time, for your support, and I stand ready to answer any questions.
Thank you so much, Charlie. We appreciate it. Open it up to questions from councilors. Councilor Draco.
Yeah, you did mention the vermin issue, and that seems to be popping up every once in a while and on Facebook. Can you illuminate to us what's being done?
So
Public outreach to the business owners perhaps?
So we follow up on any complaints that we get. So what we really do is we rely upon the community. So if you're seeing, or if you have folks that within the community that have issues with the rodents, report that to us so that we can go out and investigate it. So that's the environmental function. We've also, here in the past, we've had some videos. We've had a lot of one-pagers that we've distributed within the communities where they are affected on how to limit rodents within there. So when you have rodents, they're basically looking for harborage, food, and water. So by limiting those things, you can really cut the population down effectively. So it's a lot of prevention and making sure that we're properly maintaining the properties that we have that aren't allowing for that harborage for rodents overall.
So when you go, let's say, to a restaurant or a motel or whatever, and you see conditions that would attract vermin, how much power do you have to either enforce or fines, or how do you get them to stop?
We do have the ability to issue a notice of violation, which we've done on several occasions. And then what we generally try to do is to work with commercial properties specifically so that they have a rodent management plan in place to be able to address that. And most of the time that deals with having a professional service that's coming in on a regular basis, and then working with them to identify the areas where they need to make some changes. So if there's debris, to clear up the debris. So our folks are really, they work on an education basis. We really try not to get to the point where we're fining people, because we don't find that that is as effective as working through the education and making sure that, you know, they're doing the right thing.
But if they don't comply, what recourse do you have?
So we do have the ability to actually send them to the state. So the state can issue a lot more fines than what we have as far as that goes. We can fine them as well if their conditions, you know, are not addressed. But generally what we find is that people are doing the right thing.
Thank you.
Councilor Page.
Thanks, Mayor. Thank you very much for being here, Mr. Brown. Appreciate it. I had a couple of quick questions. One is the per capita cost for our town. Can you just speak a little bit about, again, how that's arrived at? And it looks like from one of the documents we saw that we're sort of right in the middle point of all the other respective towns. Is that so?
Yep, we're central for a reason, for a lot of reasons. The per capita cost overall is really derived from what our overall costs are. And then we look at it as a district as to what cost you would have as a town to be able to incur, you know, if you had your own health department. So our operational expenses, we take a portion of that. Mm-hmm. And then for those staff that we have that are not funded through grants and things of that nature, so our environmental staff specifically, we use some of that funding to be able to cover the overhead and salary associated with them. And as always, we have to keep the lights on. We have to keep our folks have somewhere to hang their hats. So our operational costs are affected with respect to that. And as I'm sure you guys are aware, federally, we're seeing some challenges, quite a bit of challenges, as a matter of fact. We heard today that 2 of the grants that we have for this year, CDC issued stop work notices on those effective yesterday. So the last quarter of that grant, we haven't heard officially from the state, but we're going to be losing funding from that moving forward. Those are COVID era grants. So a lot of the personnel and functions that I've talked about tonight, specifically things like our public health nurse, like our epidemiologist, are things that we're going to be looking to transition from grant funding over into our general funds.
So how do you anticipate that'll affect this upcoming budget cycle?
So it is going to be an increase. So our board actually voted at their March meeting to increase the per capita fee. Currently, it's at $8.25. And the next fiscal year, we're looking to go to $8.85. So a 60 cents increase. It's about a little over 7%, close to 7.5% increase. That is nowhere near the amount of money that what we're expecting to lose in the next fiscal year in the grants. So we are actually taking quite a bit, or the plan is to take quite a bit out of our reserves to be able to limit the impact on the towns.
So this has, and these are my last couple questions, and I'll move on. I know a lot of people have questions. One is about opioid deaths and trends, and the other is about suicide and mental health trends, especially around help-seeking norms for people with either bipolar illness or schizophrenia or depression, et cetera. Can you just speak to what those trends are looking like in our town, in our 4 towns, and how that's going?
So as far as opioids is concerned, we actually are seeing a reduction in mortality. And a large part of that is because we put a lot of Narcan and naloxone out within the community. We train people on how to use that. And that's one of the functions of our clinical staff and our recovery coach, is to be able to get those types of tools out there so that people can actually survive an overdose. As far as the mental health aspects of these things, public health is still trying to figure out where the public mental health things are associated. We still have conversations with our regional behavioral health agencies on where we fit. And I think that in the future, the mental health aspects of things like active living, on policies that we have within the community to support people that may be in mental health crisis or a substance use disorder, really are going to make a bigger difference as we move forward in the public health aspects.
Thank you. Thanks, Mayor.
Thank you. Councilor Nagel.
Okay, thank you, Charlie, for being here again and giving a clear presentation. I'd like to know a little bit more about the specific trends, first of all, in terms of inspections. Has there been an increase in some kind of complaints concerning what needs to be inspected in town? How they impacted businesses, especially in town, and could you be more specific about that?
Overall trends for inspections, generally, what we've done in the last few years, we've adopted a new code, the FDA code, and that's a little bit different than what the old code for food service establishments were. So our inspectors in the past, it was really looking at the halls and walls and the cleanliness and things of that nature. Where now the focus is really on what is the risky behaviors that exist within that facility. So our inspectors spend a lot more time watching people and what they do. So are they washing their hands appropriately? Are they changing, cutting boards appropriately? When they're using equipment, are they making the appropriate transitions? So really looking at what are the high risk behaviors, and that has changed quite a bit in how, where people pass and where they fail. So it's been a bit of a transition. I think that our folks have done a good job with respect to education, and our food service establishments really have done a lot of education themselves to assure that they're doing the right thing. In addition to that, I think it's a lot of things that we see in complaints really have been recently, especially in Newington, the rodents. So trying to get information out about that, trying to be able to work with agencies like the MDC so that when they disturb things like sewers and things of that nature, that we're aware of those so that we can kind of proactively be involved. Those are kind of the main things I think that from a trend perspective that we were looking at.
I know we have a lot more small food establishments in town. Has that impacted upon obviously inspecting when they're new, but in terms of complaints or?
No, I mean, in general, we don't get a lot of complaints about individual establishments. Our inspectors really try to be proactive and assure that they're on schedule. And, you know, we can pop in anytime. So that's one of the shifts within the FDA code, is to assure that each agency has a certified food protection manager. So each establishment has somebody who's trained to oversee that. So we're only in those establishments maybe 3-4 times a year. So we really have to trust and work with those people that are certified food protection to assure that they're doing the right things the other 360 days a year.
Okay, to change a little bit to something else, and I won't take too much more time in terms of my questions. I know you've talked about the impact of COVID in terms of monies and availabilities and that. What about COVID itself? Is it still prevalent? Is it shifted enough that it's not as crucial or detrimental as it used to be? Could you give a little information about that?
Yep. We still see COVID and we still track hospitalization data. We still track testing where it's available. The issue that we see now is the fact that not a lot of people are testing for COVID. It's become more like the common cold or just the respiratory illnesses that we see on a seasonal basis. But we do keep track of especially the hospitalizations. And we use things like wastewater screening. That's a passive way to be able to see if levels of COVID are up within a community or within a region. And we've seen fairly low levels here recently. So that's been less of an issue than some of the other things that we're addressing right now. Influenza this year was really bad and continues to be high. And, you know, people forget that we lose anywhere between 36 and 58,000 people a year to influenza alone. COVID, as I said, we're continuing to monitor that. But I think overall, the basic messages that we have around prevention for respiratories, that is stay home if you're sick, cover your cough, you know, and get tested, really do make a lot of sense, and get vaccinated for those things that we have vaccines for, to be able to protect yourself, your family, and your community.
Unrelated to that, but comes under your umbrella, so to speak. You mentioned earlier about sidewalks. And I know there's a rumor that's been going around. I don't know how true it is or not true, that the state is going to provide funds for sidewalks on Cedar Street. Do you know anything about that or anything else?
I have not heard anything about that, but I would be excited to see anything that gives us the opportunity to have safe walking conditions within our towns. Our folks, I will say, our Assistant Director for Community Health has been working with the Capital Region Council of Governments and Department of Transportation about walkability along the Berlin Turnpike. So our folks have really engaged in that process. So if there's sidewalks that are coming, she's going to hear about it hopefully first and be able to help to advocate for that. That's one of the reasons why we sit on those.
And I'll just to interject, apologies, Charlie. April 30th, I believe, there'll be a public information meeting with DOT about that Cedar Street sidewalk project. So we'll start to get the word out about that, but there'll be more to come on that.
Okay, we'll get more specifics through there. Last thing, but not least, you said that you're have done a strategic plan change. You talked a little bit more about that, but what specifically is it, or what can you add about your plan in terms of attack aside from what you've already mentioned?
So most of the strategic plan that we have really is focused upon engagement with the community overall and assuring that we have opportunities to be able to do that. So focusing on information and transparency has been a lot. So we have an annual report. If you haven't seen that, it's being revised for this coming year called the Starfish Report. And it really talks about all of our activities that we've done in the past year. So assuring that information is getting out about what we do as an agency has been one of the key strategic factors. Also, making sure that we have those opportunities to engage with the community. So the community conversation that we recently had was part of that strategic plan. In addition, with stakeholders, conversations and the ability to engage with you folks on a regular basis. So those are, I think, some of the key points within the strategic plan that we've adopted at this point.
Okay, thank you. We appreciate all you do in the past, present, and of course your staff in the attempts to keep the community health-wise safe, or to be aware of what they need to do to stay safe.
Yeah, it's
Thank
all
you.
the staff. It's got nothing to do with me.
Councilor Floyd.
Thank you, Mayor, and thank you, Charlie, for being here, for all that you do. The public doesn't see a lot of it or maybe appreciate it all the time, but we certainly do. So thank you. My colleagues have asked most of my questions. I do have one left, which is, if you could just talk a little bit more about how you operationalize equity in your work, and particularly right now in this kind of difficult environment. You talked a little bit about how some actions at the federal level may be impacting your funding. How are you folks thinking about equity and how to kind of buttress that important centerfold of your work?
Yeah, for us, it's very simple. I mean, equity is something that everybody should expect with respect to public health. So everybody should have the opportunities to be healthy within the community, regardless of race, sex, gender, orientation, what have you. It's, when we look at public health, we look at the population as a whole. So trying to assure that proactively the things that we can do to be able to allow access to the programs and services that we provide. I'll give you an example. So our clinic area is actually set up for people that have sensory issues. So, we actually worked with the Autism Society to be able to set that up appropriately so that if people are coming in to get vaccinations and they may be autistic, they may have other sensory issues, it's a very calming place. And we've had a lot of folks that have actually come into that, and they've said that's the first time that they've had their child be able to get a vaccination that wasn't a traumatic experience. So, that focus on that particular population in vaccination is just one example of how we assure equity. In the Four-Town walking competition, engaging, folks from the seniors down to kids that may have autism and may have other issues. We work a lot with groups within our community to assure inclusion in those types of events. Really, that's kind of the nuts and bolts to it.
That's great. Thank you, Charlie.
Deputy Mayor Rada.
Yes, Charlie, thanks so much for coming once again. Always appreciate your presentations. Two questions. One regarding vaccinations. We know how important it is to vaccinate, and that you do get reimbursed through insurance. Is there an opportunity for folks who are uninsured to be able to take advantage of vaccinations and vaccination clinics, and how do you work with that? Absolutely.
So in our mass vaccination clinics, we don't turn anybody away. So anybody that comes through our door, they will get vaccinated. So we write those off. That's one of the reasons why we're there to do the things that we do. So any of those opportunities, we've seen, quite a few folks that have come in and said, I need to get a shot. I don't have any means to do so. we're happy to provide that service.
Great. And my other question is regarding hepatitis C testing.
Mhm.
We've heard over the years a lot about HIV testing and how important that is, but sometimes hepatitis C maybe takes second place and it's not quite in the forefront of everyone's thinking. So could you talk a little bit about that? And are there various clinics? Who do you partner with to really get people to come out and get that testing taken care of?
So in the past, we've actually worked at places like health fairs or farmers markets where we've had our clinical staff that have been able to do that type of hepatitis C testing. It's really fairly quick to be able to do that testing. And we encourage folks to get tested.
Do you do the finger stick or?
Finger stick
Yeah.
is what they've done in the past. And really, hepatitis C was kind of the canary in the mine shaft for us with respect to the opioid issue. When I first took on this job, we started to see, and I as a health director, I have to review all of the disease reports that come in from all of our 4 towns. So we started to see hepatitis C in places where we didn't expect, with respect to younger folks. So when you start to see somebody who's 20, 30 years old that has hep C and they haven't had a organ transplant, it's generally intravenous drug use. So that really pointed us in that direction to say, what's going on in our community? So even the screenings that we do that are for that individual health issue help us to be able to see what trends are happening within the community as a whole.
And used as an educational tool or
Absolutely.
an opening
And
conversation.
we have had conversations of being able to follow up, and our epidemiologist has followed up with hepatitis C positive folks to be able to find out if they are using drugs, if they are using a substance, and that was the way that they contracted that particular disease. If there is a way to connect them with the resources, with our recovery coach, to be able to help them on the path to recovery.
Thank you.
Any other questions from councilors? Seeing none, I want to thank you so much for being here tonight, Charlie.
Well, thank you all. I will say once again, you guys have the best questions out of the 4 towns. That I said that.
We get a
last
big
year.
trophy for that.
You don't get a trophy for that, but you do get my enduring thanks for help being engaged. And I really do appreciate having the time to talk about public health and the things that we do.
He is
We
lovely.
appreciate all, yeah,
He
you
is
are. I
lovely.
love that. Yes. Thank you for all the work.
Really.
Thank you.
Thank you. Appreciate it.
Appreciate it. All righty. We are moving on to public participation in general. If you are in the room and would like to speak in public participation, please step up the microphone and state your name and address for the record. If you are on Zoom, please use the raise hand function. We'll alternate between in the room and over Zoom. And we have our.
Thanks, John.
I got this down.
He's a poet. He doesn't know, but it's.
We do have one on Zoom here. Right ahead, Miss Lyons.
Hi, Rose Lyons. I'd like to thank the Central Connecticut Health District for the services that they do provide us. Certainly do appreciate everything that they do. It was interesting listening to their presentation tonight. I'm curious about the new business item A, the permanent municipal building, and it says committee ordinance. I think it's a commission, if you could just clarify that. But I also, when you're talking about it, I'd like to find out what the process is going to be. I've followed 3 charter revisions, and trying to follow this packet in the agenda today was very confusing to me. It was a really good test. I'm having my physical soon, and Medicare asks a lot of questions, and I figured this would be my test. But first of all, the proposed ordinance 212302 is referred to in the memo, I think, as draft ordinance clean version. Was this sent to the town attorney for review as indicated in the minutes of the subcommittee? And if so, was there any feedback from the town attorney as to what he thought of the proposed ordinance? The next is the existing ordinance 212302, referred to as the current ordinance. Is this the ordinance that was published in the legal notice? And I think it was somewhere in April of 2022. Because at the bottom of the document, it doesn't show where it was approved or noticed. And I'm just curious if that's the exact wording as in the legal notice. And then on the proposed ordinance, also known as the draft ordinance, the red line, that was one of the most confusing documents that I have ever read. And I've read a lot. Having worked for the probate court, I've gone through state statutes and things like that. So the red line made this, it was a skeleton of what the existing ordinance was in my mind when I read it. So I'm wondering if this is the old ordinance 212302 is going to be repealed, which would make sense because that was an ordinance that was approved under a previous town council, and then replace it with a new ordinance. And I think your next one is 232504 because the cultural district was 232503. Just if you could go over it a little bit, and if there's going to be a public hearing or not on this, and if there's going to be legal notice. I sat through the original municipal building committee, commission, whatever, and it was worse than what people tell me a root canal is. I hope I never experience it, but I'd like to know what this process is going to entail, if you would please.
Thank you, Ms. Ryan.
That's it.
Appreciate it. Thank you.
Thank you, Rose.
Good evening.
I got some information hot off the press, so I wanted to present it tonight under public participation.
Very good.
I'm Jeff Trummer, 148 Maple Ave, also the Newington Fire Chief. This is something that we've been working on since 2023, and we finally actually have an answer from our ISO review.
Oh, what?
So,
Thank you.
this just came today, so I just wanted to present it to all of you.
Congratulations.
What I sent you guys in the package is actually the letter that was sent to the town manager, or was part of the package for the town manager, plus the actual PPC summary that breaks down all of the numbers and our scoring. So the Newington Fire Department is proud to announce its recent achievement of an ISO Class 2 rating, a distinction that places it among the top 5% of fire departments nationwide and top 5% in the state of Connecticut. This ISO Class 2 distinction puts Newington Fire Department as the only fully volunteer fire department in the state of Connecticut with this rating. This rating awarded by the Insurance Services Office, ISO, through the Publication Protection Classification Program reflects the department's exceptional commitment to fire protection, community safety, and excellence amongst departments in the state of Connecticut. What exactly is ISO? ISO is an independent organization that assesses a community's fire protection capabilities to aid insurance companies in establishing rates for premiums paid by residents and businesses. ISO ratings are determined based on 4 primary components: the fire department, our staffing, training, facilities, equipment, basically all of our record keeping, emergency communication center, the 911 call center, which is the police department, the water supply system, which is the MDC hydrants, maintenance, and so forth, and our community risk reduction efforts to reduce losses through fire prevention, public fire safety education, and fire investigation. An overall score between 1 and 10 is recorded, with 1 being the best and 10 indicating a department's failure to meet the minimum requirements. Out of about 45,000 fire departments assessed nationally, about 2,000 or about 3% receive an ISO rating of a 2. The ISO Class 2 rating is a testament to the department's rigorous training, state-of-the-art equipment, and strategic planning. Achieving this milestone demonstrates the dedication and hard work of the Newington Fire Department members, as well as the strong partnerships with local agencies, including the Newington Police Department, the Metropolitan Water District, the New Britain Water Department, the Newington Fire Marshal's Office, mutual aid partners, community residents, businesses, and elected officials. This achievement reflects our unwavering commitment to protect the lives and property of our residents. It is the result of years of effort, collaboration, and investment in our community safety. The Newington Fire Department remains dedicated to continuous improvement and maintaining the highest standards of service. This achievement underscores its mission to safeguard the community through an innovation, preparedness, and teamwork while operating within the department's core values of excellence, professionalism, and service to all. This is something that our department is extremely proud.
Should be.
And I hope every one of you, supports, our members and our department. Again, the chiefs, all of us, we've worked extremely hard to get this rating. And again, the members, the same thing. So like I said, I just received this. I wanted to present it tonight to all of you. This is something that we're very, very proud of.
We are
Very
too.
good.
We're really proud.
Nice.
A highlight of my night, for sure.
That's fantastic, amazing.
Anybody else? Come on up, sir.
Good evening. Thank you. Thank you, Mayor, Town Council, Town Councilors, and Mr. Town Manager. I haven't been out here in a long time, but
Your name and address.
Oh, I'm sorry.
Yeah, you're in a while.
We know you, but-
We know you. but-
It's been that long?
Yeah.
Anyway, Michael J. Fox, 1901 Main Street. And I have a couple of things I wanted to talk about. Number one is the Environmental Quality Commission. I haven't heard anything about it in a while. And I remember, we first started this, I think it was it's something like, I forget, when Dominic Mazzacoli, he should rest in peace, was mayor. It started as a committee to talk about golf. And we wound up, evolving into an actual commission. Our charge was to make sure that all the town agencies and buildings were kept environmentally safe. And in other words, we made a bunch of proposals, which all weren't followed, of course, but we had moved the oil tanks, getting out of the ground and up on top of the ground, and had suggested the electric buses that went over like a lead balloon. But anyway, transformers, this, that, and the other thing, and cleaning up the mountain and stuff. And while I was chair, we did an awful lot. And then kind of slowed down. Then Patty Foley, she rest in peace, did just as much. I haven't heard anything. I'm not volunteering for anything. I don't know if that day has passed or not, at my age. But at any rate, I was just wondering if there was any talk in your town committees, about appointing people to the Environmental Quality Commission, to kind of, and I think Matthew would be a great liaison for that. He was very involved, and so was Gail in the Cedar Mountain stuff. That's it on that. Now, there's one other thing. As a veteran, I see a lot of things a lot of issues in the VA, and I'm in the VA a couple of times a week for one thing or another. And there are a lot of issues with claims and with compensation problems. Now, I feel that one of the reasons that this is so is there's a statute that calls for all 169 towns, cities, and villages to have a municipal vet rep on staff somewhere. I don't know where it would be, whether it be under the town manager or what. We don't have one. And although, right now, we only have one veterans organization, I may go over a little bit. Veterans organization, and that's the American Legion, of which I'm a member. The VFW, which I'm a member, is no longer here. But at any rate, there's so much going on that I had tried to talk about this, not at the last time we did anything with the charter. We've done it before. I think Gail was talking about it along with me, Councilor Draco, and so was Carol Annis and a couple of others about a town, veterans committee, not the Memorial Day Parade Committee. What we need is, I think, is first for that municipal vet rep. And I don't know if you want, I could come in and talk to you, find out what we have to do about it, John. And I'll call you. But their charge would be not ceremonial. Their charge would be helping those that there's still about 31,000 veterans in this town. And many of them, like myself, use the VA, and I know how to get around things and get things done. A lot of especially Iraqi veterans don't, and some of the older veterans that in Vietnam, my era.
1 minute over, just so you're aware.
Okay, give me a couple of minutes. Need some advice on how to go about putting in a claim to one of the service organizations. And I'll finish here, and if I'm still awake at the end, before I go home, I'll come back and talk a little more about it. All right? Thank you very much.
Thank you very much.
Thank you.
Anyone else in the room or over Zoom that would like to speak in public participation? Seeing none. All right, we didn't get any email correspondence. I don't think, correct? Good. All right, move on to remarks by councilors and public participation. Comments from councilors. Deputy Mayor Rada.
Yes, I wanted to respond to Mike Fox. Mike, I know this is a couple of years ago now. You and I and several other folks were working with our state rep, Gary Turco. He organized a Veterans Advisory Committee here for the town of Newington. And I'd be very interested to revitalize that. And maybe we can have a conversation and we could talk with Representative Turco. Okay.
I was up there, not the representative, because we were many of my just as a veteran that would like to see something done to make sure that other veterans know how to put in a thing.
I'll work on that. I know that there was an informational session at the library this year.
Very good. Councilor Gonzalez.
I just wanted to congratulate the fire department. That's an amazing achievement and an accomplishment, and definitely very proud of you, and I'm sure everyone is. So thank you so much and congratulations.
Councilor Floyd.
Thank you, Mayor. Coop, the same as well. We are incredibly proud of you. That is a miraculous, phenomenal achievement, but it's not miraculous because all the hard work that went into it, we saw over years what you folks were doing to get that done. So congratulations. Just some things to Ms. Lyons's points about the PMBC. This process is the same as it is for any ordinance. To amend an ordinance, the council obviously has a process on the books to do that, which includes a public hearing, various legal notices, so the public can be aware of when that hearing is taking place. And then we can amend an existing ordinance. That was the charge that we were given as a subcommittee to review that ordinance and suggest those amendments. And it's now in the council's hands, or it will be starting tonight, to review those amendments and then act on them, or not act on them as they see fit as a body. As far as the items included in the packet, I couldn't understand, there were 3 copies there. I can understand why it may have been a little confusing to track down. It's just with full transparency. I know it's important for us to include that for the public's sake. The first copy that you see there, as you said, is the clean version with amendments that have been transmitted from the subcommittee to the council. That is the version that we will discuss as a council starting tonight. The second version is the existing ordinance on the books without any changes. And the third is that existing ordinance, but with the redlined changes that the committee made. And we'll talk a little bit more about that tonight. And I'll leave it there. Thank you, Counselor.
Counselor Page.
Thank you, Mayor. I also would congratulate the fire department. Extremely proud and recognizing all the hard work that everyone put in from chief through all the ranks, I'm certain, to achieve this milestone. And at some point, because this just is hot off the press, so maybe it's a little premature right now to request this, but when it's available to see what the actual impact would be if the median home price in Newington is around 290 or 300,000 and the average homeowner insurance bill's about 1,500 a year, how that will change our insurance premium in a positive way. We look forward to that report when it's available, when that data is available. So thank you very much.
Counselor Menke.
I would also congratulate the fire department. I'm calling my agent tomorrow for this information. May 1st. I'll wait till May 1st. Well, that's good because my premium is up on May 15th. So I'm going to call them and tell them that we get, but again, I congratulate you. I know this is a lot of hard work. I happen to be liaison to the fire commissioners and I get to see the effort that you folks have put into this. It's not just, you didn't push a button. It didn't fill out a piece of paperwork. It's been a long drawn out process that you've been working on for months and months and years. And I appreciate all the effort, all the time that went into doing this. It didn't just snap your fingers and it happened. It was a major process. And I'm so happy that we got the results and we got the results we wanted. It would have been anticlimactic if we got there and said, we stayed where we were. But I appreciate all your efforts. It speaks volumes for your staff and for the men and women for the fire department that put in the effort to get us to this point. And I'll call my agent on the 16th, May 16th.
Thank you, Counselor. I echo what's been said. I think, I know that you guys have been putting in a ton of time to get this done. I remember the first time hearing about it, I was sitting over there as a planning and zoning commissioner. So I know you guys have put in years on this to get to this. And I know it's not an easy thing for a volunteer department to do. And we are incredibly proud of the effort that you did to get this. So just congratulations. Thank you so much. All right. Any other comments from counselors? All right, seeing none, we'll move on to consideration of old business. We have one item on that, it says set tentative budget. At this point, I'd like to reinform the public that we are at the middle of our budget process and will not be setting a tentative budget tonight. I don't believe we have any changes or anything to propose at this point. So we're going to leave that on the agenda for the next couple of meetings until we get to the end of our process. Any questions or comments from counselors? Anything from our manager? No?
Nope. Janet is standing by with her spreadsheet online, so I think she can shut down her computer now.
You're off the hook, Janet. Thank you very much. All right, we will move on to item 8, tax refunds. Deputy Mayor Rada, would you please read the resolution?
Absolutely. Resolved that the property tax refunds in the amount of $1,875.54 are hereby approved in the individual amounts and for those named on the request for refund of an overpayment of taxes certified by the revenue collector, a list of which is attached to this resolution.
Second.
Motion by Deputy Mayor Rada, seconded by Councilor Draco. Any discussion? Seeing none, all those in favor?
Aye.
Any opposed or abstain? Motion carries unanimously. Moving on to minutes of previous meeting, approval of February 25th regular meetings. Any changes that anyone needs to make? If not, I'd entertain a motion to approve.
Yes, I do.
All right,
I
Mr. Counselor Nagle.
You'd be disappointed.
They're very minor, and I know sometimes spell check can change things from what is the intended thing to print. You don't need to go look it up necessarily, but on page 14 on my comments, it's in the middle of that paragraph. It says Clue Clinic, and it should be Flu Clinic. And another thing in terms of, it had to do with a senior center upcoming event in nutrition. It's not a good cost, but a good cause. So those are two minor things, but they do kind of change things. Yeah. That's all I have for the moment.
It's a good cost too, but it's a good.
Yeah, it is.
Well, that's better cause.
Thank you, Counselor Nagel. I would entertain a motion to approve the minutes, including Counselor Nagel's
So moved.
fixes.
Second.
Motion by Counselor Maggie, seconded by Deputy Mayor Rada. Any discussion? Seeing none, all those in favor?
Aye.
Any opposed or abstained? All right, motion carries unanimously. All right, moving right along to resignations. Counselor Page, would you please read the resolution for the resignation? We have one.
Thank you, Mayor. Resolved that the Newington Town Council hereby accepts the resignation of Joanne McCormick as a member of the Zoning Board of Appeals in accordance with the correspondence received on March 10, 2025, and effective immediately. And just to note, a typo, it should be, I believe, Joanne, not Joanna,
I think it's got an E.
right? With an E.
Oh, yeah, Joanne with an E. Yep.
Yes.
Motion by Counselor Page.
Second.
Seconded by Counselor Mankey. Any discussion? Seeing none, all those in favor?
Aye.
Any opposed or abstained? Motion carries unanimously. Moving back, Counselor Page, we have one appointment. Would you please read that resolution?
Yes, Mayor. Resolved that the Newington Town Council hereby makes the following appointments to the Zoning Board of Appeals of Robert Kane, member, address 155 Brentwood Road, Party D, term immediate to 11/30/26, replaces vacancy of Joanne McCormick.
Second.
Motion by Counselor Page, second by Counselor Mankey. Any discussion? Seeing none, all those in favor? Aye. Any opposed or abstained? All right, motion carries unanimously. Now we are moving along to consideration of new business. Item A, permanent municipal building committee ordinance. I believe the subcommittee is here tonight. Yes, you are.
In the building.
Deputy Mayor Rada, do you guys want to sort of prime this and give us explain it? a little bit?
I will
Or do you guys
defer
want
to our chairperson.
Sure.
Council
Oh,
Fleur.
shit.
Yeah.
I'm sorry. I don't know.
That's right. That's right. Happy to.
It's another committee.
Happy to. So obviously, this has been a long process, and before I get into a lot of specifics, I just want to thank Councilor Nagel, Deputy Mayor Rada, and Lauren, our Assistant Town Manager as well, for all of their hard work throughout this process. We went through, as I think I've said before, 6 drafts total throughout this process, taking it by pieces each time. And we got a lot done. Now, there was mentioned by a member of the public that you'll see on that third copy, there's a lot of red. A lot of the red that you see is actually reorganization or grammatical changes or things like that. It's not substantive. In other words, the changes that we made really focus on 3 areas in particular. The first one was about rewriting the ordinance for clarity and for transparency. There were a lot of instances in which we found that there were sections that were reiterated in some of our procurement policies, that were reiterated in some other parts of our administrative policies, other things like that, that just didn't need to be laid out here, but could be referenced back to make things a bit more clear and a bit more concise. So that was something that we did. We also made certain to clarify that what is included under an ordinance like this, the town, Board of Education and Fire Department buildings, if they're referred to this commission, could be subject to this process again, if they're referred. And obviously, we also looked very closely at the definition section in particular, which had a lot of duplicative language and also language that just wasn't necessary. So we kind of tightened up a lot of those definitions and expanded on some of them a bit where appropriate. The second change substantively was the expansion of membership. If you'll recall the existing ordinance, and you can see it, the second copy in your packet was a board of 5 people. We've expanded that to 7 people. And that we had very long discussions about, very productive discussions about. But those 2 added members are for what we've defined in this new ordinance, a proposing body. And you'll see that on that first page of this new ordinance, the proposing body being the Town of Newington Department, appointed or elected board, committee, or commission sponsoring or requesting a major construction project, major renovation project, or major demolition project. And so the best way to describe this is to give definite, or to give examples. That could be the Board of Education in the case of a school building. It could be a committee formed by the Board of Education or the council to look at a school building. It could be a pool committee. It could be things like that. So it puts into perspective a little bit more about how our current process jives with the amended ordinance that you have before us here. And the last change was about this very specific section, which you'll find on the second or third page of the current ordinance, that prevents people from serving on this board if they serve on other boards in the town of Newington. And we had a very spirited discussion about this as well, and came down on the side of wanting to ensure that we have enough people to fill different spots in important functions in these boards and commissions. Obviously, we all know that it can be very difficult to fill some of those spots. So rather than kind of flatly deny the ability of folks to serve on a commission like this if they serve on others, we instead removed that and input in its place a recusal clause, so that if there are members serving on other commissions and boards that have cognizance over matters that would come before this commission too, that they would be required to recuse themselves from voting on those matters. So again, this has been a very arduous process. It's been a long process. Ultimately, we were guided by the need for transparency and efficiency. And at the end, we all agreed, us 3 members, on these changes in this packet that you see in the amended proposed ordinance before you now. That's it. I'm happy to answer questions.
I'm gonna ask the question that Ms. Lyons asked, and was this language reviewed by our town attorney?
Yes, it was. Yeah. So when we got very close to the end of this process, the 6th or 5th draft, we sent that over to the town attorney for review. And they did come back with some very non-substantive small changes in language, and we made those changes. So we are in compliance with the review.
Very good. Thank you. Councilor Pedrego.
Yeah, and again, I apologize. I read it today and having been involved in the last one, I just have a few questions. On page 2, under the membership, on the 2 additional voting members, for Lucy Robbins Wells Library, does that mean there's a possibility of there being 4 members of the library in the event of, dependent on the project proposed for the library?
And it's a good question. It's not the case. If you see there in that section, it says those 2 additional voting members are either reviewed and recommended by the proposing body, et cetera, or in the case of the Lucy Robbins Wells Library, et cetera, that's who those 2 voting members would be. So if there was a project building committee for a library, which sounds quite plausible, it would be 2 members that are suggested by the library and appointed by the council. So 7 total at any given time.
Okay. And regarding that, just because of the way other commissions are structured, the 2 additional members, representing the requesting body, there's not gonna be like a party affiliation, so it could be 2 Democrats, 2 Republicans, 2 whatever.
Yeah, I mean, so obviously we were cognizant of that. I think the anticipated need is that 1 would be from either party. We actually talked at times about there being 3 or there being 4 or et cetera. And in our discussions as a subcommittee, we were clear that we wanted it to be 2 and that 1 would come from each major party represented on the council. So
So for example, if the fire department had a building, their two representatives, one would have to be,
A Republican and one would have to be a Democrat.
Okay.
That's correct.
and then just one more, and again, I think way I remember the original building committee is there was gonna be this group of, the group of five, who would kind of, I don't know, be overseers and always have to be cognizant of what the resources are, what the priorities are, whatever. But then after that, and they agreed and that a project should go forward from the requesting body, there would be like an actual, another committee formed. It's like this committee would be like the overseer and, look at everything and say, yep, okay, we agree. But then another not a subcommittee, but a committee would be formed. Is this gonna be like except for the two members that are dependent upon the project and the requesting body, these five people, or the five people at least, are gonna be members of every building committee, but they will be supplemented depending on what department is requesting the project, would be supplemented by two. But there's always gonna be, so there's not gonna be any like subcommittees, there's, you know what I mean?
Yeah, I think I think I know your question, and you tell me if I answer it, but yeah, there's gonna be that core five, just as there is in
Across
the
all,
existing.
okay.
That's right, across all building projects. Of course, if somebody resigns, things change, but there's that core five.
From
Those-
beginning to inception.
From beginning to
be
inception,
included.
regardless of project.
Okay,
And then those two are those proposing body members that obviously change based on their jurisdiction.
okay, thank you.
Counselor Menke.
I just would thank the committee. I know this is a whole year-long process and it seemed to drag on. I'm sure it seemed to drag on and be on your schedule forever and ever and ever. You didn't meet on Friday nights, right?
No, not Friday nights, no.
They were busy on Friday night.
They were busy.
That's right, that's right.
My only question is, or maybe my just for my clarification, if we decided to build a new town garage, there would only be a building committee of 5 people. Is that correct?
Yes, that's right, because
Because
there
there'd be no
would be a
requesting
proposing body.
authority.
That's right,
That's right.
that's right.
If
That's
we were building a
exactly
new town hall, it'd be a 5.
That's right.
5 person.
And I would add, we have some advisory membership here as
Yeah,
there was in
I
the
saw
opening.
that.
So
That
staff
made
could
sense.
still be,
Right.
absolutely, but that's exactly right.
Okay.
Great question.
We just have to hope we don't have so many building committees at once, because those first 5 people will be stretched
True.
really thin.
It's true, and it was the same with in some ways, it's a good check on the number of capital projects that a town can take.
Well,
on
I
at a
mean,
time.
we also can't afford to do many
Exactly.
building committees at the same time,
True.
because who can afford that? Thank you.
I appreciate you guys' work on this. I know you guys put in tons and tons of hours on this and Lauren too. You guys are busy working on this. I really appreciate your efforts. I'm gonna continue, I think we'll continue to review it and look forward to bringing it back on the agenda at our next meeting and for hopeful adoption.
Thank you.
Any other questions? from those?
I just,
Thank you.
Go right ahead, Deputy Mayor.
just, again, in response to a question by Ms. Lyons, asking about, what did she ask about? About a public hearing. Before this is adopted, voted on and adopted by the council.
Yeah, so that
Yeah.
the next meeting, we would formally introduce it pursuant to the terms of the charter and then set the public hearing. So that would be basically the next step would be to do that.
Is that the process for an amending an ordinance too?
Yes.
Okay,
Right.
just checking, okay.
Just for point of clarification, there were 2 items that the committee had sent back to the town attorney for review. So we do have 2 more additional potential changes to bring to you once we meet again. And then obviously any changes that you would want to make to this draft, I think would go back to the attorney. I would advise to go back to the attorney for the final review before you set that public hearing and really send the final draft out.
And for the record, Ms. Lyons was correct. It is a commission, not a committee.
That's
The agenda is wrong. My bad.
Okay, so just so in terms of process, we still have 2 more meetings at
Yeah.
least to get, okay.
So we knew that this had been going on
Sure.
long enough. We wanted to bring you all a draft, we had discussion changes so that you had time to really invest in what all the things that the committee is recommending.
We really appreciate that for sure.
I think,
Councilor Mackey, go
I
ahead.
think just realistically, time wise, we have a public hearing next meeting and then a public hearing. Or then the budget.
We have
meeting
two
after
public
that.
hearings
We
after
don't really have time to do it, but even though we might want to, I think this wouldn't happen until sometime in May.
Anyway.
Just to give it its due diligence,
Right.
to try to rush it through, I think is,
No.
and it's not. An immediate rush, I don't think, so I think we probably can, wait till get all our ducks in a row and then have a chance to digest it.
Yeah, I'm glad.
Sure.
Right, very good. We'll move on to item B. Consider sole source contract for replacement of fire station number 1 bay floor. And give us.
Yeah, I mean, I'm gonna defer on this to the chief, to come up and talk about this.
So at the last meeting, the approval was to move the funds over to the CIP budget and transfer it over to Company 1 Bay Floor. We have a contractor now. So instead of going out to bid, we actually have a sole source letter because they use a specific product for the floor. And we're just looking to get the bid waived to be able to move forward with the project. If you have any questions on the flooring, I believe this is the Stefano Brothers, this is Cal. He can answer any questions that you guys have. So fire away if you need to.
Councilor Page.
Thanks, Mayor. Thank you for being here.
Absolutely.
Because I did a little research knowing nothing about your business, but in looking out for the taxpayer, of course, and making sure we're doing due diligence. 2 questions. One is square footage. How much are we covering? Maybe 3 questions. What is already on the existing other areas of the floor? And then in looking at other products, if you could just explain the rationale for why your product as compared to some that I've seen are Citadel. Are you familiar with Citadel? Or Rust-Oleum? Rock Solid, Armor Epoxy, Versatile Building Products, and Epoxy Master, for example. Why yours as opposed to those other products?
I appreciate your homework. Not many people know those manufacturers.
I don't
It's great
either
to
until
hear.
I looked them up.
Yeah, so the biggest thing with Pentec, that's the manufacturer that we're the sole source distributor
Right.
for. It's the highest solidity rate in the market. So the way you measure these chemicals and what we're talking about is a chemical called polyurea. The difference between a polyurea system and an epoxy installation, which, the traditional garage with the peeling up tires, that's what that is the kind of adhesion that you get to the concrete. So what we can make with the system that we have is a chemical bond with the floor itself. We all remember like 4th or 5th grade physical versus chemical changes. This is a chemical change. So the solidity rate, what that measures is how much of the chemical that we're putting on the floor is there to bond to the concrete and how much is there as an outgassing agent to help it cure, right? Because chemical reaction, we have a cure. So with Pentec, it's 99% solids, which means that 99% of what's going onto the concrete at the fire department is going in there to bond into the concrete itself. So what that gives the fire department is a patchable system with a lifetime warranty through the manufacturer Pentec. We actually do work with Citadel as well.
Okay.
Yeah, so we do work with Citadel.
That was the one that was most highly regarded relative to your product.
98%.
What I read, yeah.
Yeah, so we do Citadel. We manufacture with Pentec and Citadel, or
Right.
install rather. With Pentec, we're the only show in town. We have sole source for Connecticut, Massachusetts, and Rhode Island. And the biggest thing is the functionality of it.
Right.
So with 99% solids content in the polyurea base coat, it's going to be the best adhesion
For
on the
commercial
market.
applications.
Exactly.
Right. So, and the square footage, and then is there an existing surface that you're matching up to or pairing with, or is it
Yeah.
the entire surface that's going to be done?
So currently, right now, what we have is a tile floor. It's a rubberized tile floor. We would actually be ripping all that tile floor out because that's actually what was failing,
Right.
which was causing the hump of the trip hazard. So all that would be removed. They would actually come in with machines. They would diamond grind them the whole floor down. Basically, make it nice and smooth enough so that the adhesion takes to it. They would come in, I believe it's 4 layers, correct?
Yeah.
4 layers. It would be a waterproofing plus 3 layers on top of that. That would completely seal the floor. And it's also actually going to bring up to the sides of the walls. It would actually come up 4 inches, I believe it is.
For wash.
So it actually comes up and the water kind of stays with it, so it doesn't wash off. So we're doing the upstairs bay floor and that would also be the downstairs bay floor, so both floors.
That's roughly how many square feet?
5,400.
Yeah.
That's all I got.
5980 is the total area. What we're working on specifically about 5,400.
All right, thank you very much. Thanks, man.
Councilor Draco?
Yes, if you've done, I'm sure you've done similar work, but in the area, other fire departments, and I'm assuming that Chief Sharma, you've gone out and looked at, talked to the other chiefs.
We have, North Branford was one, Yukon Fire Department is actually in the midst of doing their floor over. There was a department in, I believe it was Rhode Island, correct?
Yep, we did Rhode Island, we did Seymour.
So we called all of them and they're very happy with, the product and they've had it for a couple of years now and they've had no problems. And if they did have a problem, they would call them up, they would come out and fix it.
How long have you been in business?
Since 2006.
Okay, thank you.
Thank you. Any other questions from councilors?
And just one other thing, the difference between epoxy versus the system that we're looking for, epoxy is almost like glass, where this system's almost like plexiglass, if you want to say. It's got a little bit more give than the glass. So that's the difference between epoxy and what we're using. So it's actually going to give us a little bit better life on it.
Lifetime warranty commercial, peeling, chipping, delaminating. It's only one on the market.
Councilor Menke?
Just to. Oh, and water where the trucks is, it's slippery? Is it,
We actually added a slip resistant texture.
there's a texture to it?
Yeah, it's consistent with the other fire departments that we've worked with where they found success in it. Again, the biggest priority with doing this is safety for the people working
I
on it.
assume so, because
Right.
you bring a wet truck in. it's gonna
Exactly.
get slippery.
Yeah. So
With my luck, I'll be the one to slip and,
yeah.
and there goes my insurance savings from.
It's sort of like a sandy base, kind of grit to it.
Grit to it, okay.
So you can't slide on it basically. So it's built right into the actual floor the way, when it gets put down.
Deputy Mayor Rada?
Yeah, just one question. I know that as we move along, that apparatus gets larger, weighs more. There are many more components to each of the trucks, each of the engines. You said that this has a lifetime warranty, so regardless of the apparatus that you are going to be pulling in and parking, you don't see any
No,
consideration or any.
the only thing that
problems
we've
with
seen with fire departments has been like spiked wheels on tractors for snow removal, like
Take
metal
off the
studs.
spikes.
Yeah.
We don't use
I
it.
know.
Yeah, we kind of covered all the no-goes with the floor. The biggest thing is if we have to cross that bridge, it's patchable. Whereas an epoxy system, you'll have to start from scratch, rip everything out if you have an issue with it. So they're prepped and actually can give data sheets too that we can post up in the actual department of, hey, these are no-go chemicals, these are okay. We've gone through them before, but I think it's always good as a reference point for all the fire departments that we do to have everyone be aware of what this floor can handle.
And just quick question, is it solid, hard, or is there some give, some, I don't want to say spongy,
To
but
your feet, it's solid. Yeah, it's relative to concrete, it's very flexible.
okay.
But to your feet, it feels nice and tough.
If you want, I can send a video of the actual system and you can actually see how it, compared to epoxy, and you can actually see the testing that they do to it. If that's something you'd
Yeah,
like to
that'd be
have.
That'd be great, thank you. Thank you.
Absolutely.
Councilor Pacheco?
And just one other question, in terms of routine maintenance, washing, whatever, are there special, can you just throw, detergent on it, or are there special
in the mouth.
chemicals that you have to use
No
or
special
be
chemicals.
careful about how you brush it or anything?
Great question as far as use and care.
Yeah,
If
yeah.
people get this down, they want it to look good for life.
Okay.
Dawn, Simple Green, CLR, nothing special, anything off the shelf. You don't have to get a special product or anything like I've heard horror stories with. Really anything with a degreaser. And the way we clean it is we cover the area with soap, very generous. We hose it, no short supply at the fire department. And then we bristle brush it to get in the grooves, because like we said, there is going to be a texture in it. So it's really important that we don't just squeegee it. We use a bristle brush to get in those grooves, and that'll keep it nice and clean.
But they do it, not you.
Yeah,
Once
we're
a
not
week,
that
once a
doing it.
That's
We'll negotiate that.
Yeah.
Thank you.
Absolutely.
Other questions from councilors? Thank you guys so much. Thanks for being here and thank you.
I appreciate it.
Thank you very
Thanks.
much. All right, moving on to item C, Emergency Management Performance Grant.
Yeah, and,
Add a little bit, John.
yeah, this one, there's a waiver request, because the deadline for getting the paperwork into the state is the end of the month. We get about $15,000 annually from the state based on the previous year's emergency management coordinator expenditures. And it's just basically a administrative formality to get the paperwork in, authorizing me to sign the paperwork.
Any questions from councilors on this? All righty.
Who requested that?
Yeah, they're requesting a waiver for tonight. Maybe you have to, if they want to get it, it's gotta be. in the
Yeah,
month.
absolutely.
All right. Council Plord, would you please read the resolution?
Sure.
First part, I guess.
Resolved that the Newington Town Council, in accordance with Section 14 of the Town Council Rules of Procedure adopted April 9th, 2024, hereby moves to allow action on Agenda Item 11C to approve authorizing the Town of Newington to enter into with and deliver to the State of Connecticut Department of Emergency Services and Public Protection, Division of Emergency Management and Homeland Security, any and all documents which it deems to be necessary or appropriate for the fiscal year 2024 Emergency Management Performance Grant, and authorizing Town Manager Jonathan Altschul or his successor to execute and deliver all necessary documents and perform all acts necessary to carry out the terms of these documents.
Second.
Motion by Council Plord, seconded by Council Tiniakis. Any discussion on this? Seeing none. All those in favor?
Don't you, for that, I think you need.
Oh,
to-
that's right. You're right. I'm sorry. Correct. Yes, we, because we're waiving the rules, I will open it up for public participation on this agenda item only, and we do have one hand up. Go right ahead, Ms. Lyons.
Hi, Rose Lyons, 46 Elton Drive. Obviously, I have no objection to the waiving of the rules in order to get the money for this emergency management thing, but every year for the last 15 years, I think it comes in at the same time and it has to be waived, and every year I ask, what is it at the state end that we don't get the announcement to when we have to have our application in, that it has to be waived every single year? I don't think it's at our end. I'm thinking it's at the state end that we don't get it in time, but I just would like clarification again on that and see if that's still the case. Thank you.
Thank you, Ms. Lyons.
Thank you.
Anybody else in the room or over Zoom that would like to speak in public participation related to this item? All right, seeing none, we had a motion by Council Plord, it was seconded by Council Tiniakis. Any discussion further from councilors?
Did we want to have a response from either the town manager or assistant town manager about that?
I don't know the answer to the question. I think it's a valid one. I'm now aware of it, and so I'll work with DJ to make sure that we can try to do this the regular way in 2026 and beyond.
Okay, thank you. All right. All right, we have a motion and a second. All those in favor?
Aye.
Any opposed or abstain? All right, the motion carries unanimously. Would you read the second part, Council?
Sure.
Resolved that the Town of Newington Town Council may enter into with and deliver to the State of Connecticut Department of Emergency Services and Public Protection, Division of Emergency Management and Homeland Security, any and all documents which it deems to be necessary or appropriate for the fiscal year 2024 Emergency Management Performance Grant. And be it further resolved that Jonathan Altschul, as Town Manager of the Town of Newington, is authorized and directed to execute and deliver any and all documents on behalf of the Town of Newington Town Council, and to do and perform all acts and things which he deems to be necessary or appropriate to carry out the terms of such documents. Be it further certified that Jonathan Altschul now holds the office of Town Manager and that he has held that office since August 12th of 2024.
Second.
Motion by Councilor Page, seconded by Councilor Nagel.
Council, Lord, we said.
Oh, I'm sorry, yeah. Councilor Plord, seconded by Councilor Nagel. Any discussion on this?
Just a quick question.
Counselor Mackey?
I keep getting my butt fast now.
Oh, you're good.
Where does this money go?
It goes into the general fund. I mean, it's offsets
It
the,
offsets.
the emergency management, coordinator, budget line and budget category, but it's,
We're operating.
it's directly related to the previous year's expenses. I think it's like 50% of the previous year's expenses.
Thank you.
Any other discussion or comments or questions from counselors? We had a motion by Counselor Floyd, seconded by Counselor Nagel. All those in favor?
Aye.
Any opposed or abstain? Seeing none, motion carries unanimously. All right. See, end of new business.
This is scary. Just quick.
We're moving on to number 12, written oral communications from town manager.
Yeah, just a few things to bring to council's attention. We've had we had the third of the town pools building committee or project committee, excuse me, since the referendum was held last night. That meeting, that committee authorized the issuance of an RFP to evaluate the current conditions of the pools. So that will be going out on the street shortly. We had there's been a lot of, at the staff level certainly since this predates me being town manager, but the meetings are starting to become more frequent about, the future of the emergency, communications tower and what the future holds for that. And I expect to have something in front of council in the next maybe 1 or 2 months to act on, but I feel like we're starting to get to a good place and there's going to be a resolution that is not going to be a problem, let's say, for the town. And finally, we had a productive meeting with representatives of the Hindu temple today regarding some concerns that were raised at their Holi celebration from 2 weekends ago. And we look forward to having, continued positive relations with that, the Hindu temple community, as well as the residents adjacent to that Church Street, New Britain Avenue area, to make sure that, we're all living in harmony moving forward. So good things.
Thank you, Jonathan. Any questions or comments from counselors?
I just have one thing, if I can.
Counselor Floyd.
I'm sorry, I couldn't get my thing. Just wanted to touch base with you, Jonathan, about any upcoming grant opportunities that we should be aware of. I know.
Actually, very good timing.
Great.
So tomorrow morning, we have at 10 o'clock, we have our department head staff meeting. Sonia Richmond is coming, and that's literally the topic of the agenda. So, we did put in for that STEAM grant, the STEEP grant, the Small Town Economic Assistance Program grant for the Candlewick Park. It was about 2 weeks ago, probably that application went in. I don't think we've put anything since then. I don't think anything's in the works, but there's gonna be a lot more discussion around that coming up.
Perfect.
Thanks, Jonathan.
All right, move on to item 13, council liaison and committee reports. Updates from counselors. Counselor Gonzalez?
I just wanted to let everybody know that the Youth Adult Council has a fundraiser tomorrow night at Moe's, and all money raised goes towards 2 scholarships for high school seniors, for 2 high school seniors. So please come out and support.
Where is that again?
It's at Moe's.
Moe's, thank
Yep.
Turnpike though.
You don't
Yep,
have to
on
ask me,
Turnpike.
but
Turnpike location.
Yes, please support. Great
Absolutely,
cause.
some tacos.
Sounds good.
Counselor Draco.
Just real quick, the story continues about the Kits Lane development. The public hearing, the second public hearing isn't closed. But because there were a few items that came up during the hearing regarding snow removal, height of border plantings, they wanted to have that incorporated in the final package. So although the public hearing has been closed, they will be voting on it at the next Conservation Committee meeting.
Counselor Floyd.
Thank you, Mayor. Just wanted to, not a liaison report, but just wanted to shout out the musical at Newington High School, Once Upon a Mattress, was a
Fantastic.
phenomenal
Prince
show.
himself.
We have the star himself.
How did you manage
in
your stairs?
the room. There was a phenomenal job as always, and we're just so proud of the program that we have at the high school and the incredibly talented students that we have. And the applause needs to keep going because yesterday, a few of us also participated on both sides of the aisle in a terrific panel that Adrian put on at the high school with students after school who came together to talk about civics of all things, and do that on a Tuesday night. So, or on a Monday afternoon. So we were so glad to participate in that and look forward to going back. And then just wanted to also shout out 2 exciting new openings in town. We maintain our reign as the chicken capital of the world. We've had Dave's Hot Chicken open up on the Turnpike. The line is out the door. So if you haven't tried it yet, you should definitely go take a look. And also Around the Clock for Tots, a childcare center also opened up in town. And we're so proud and glad to have them as well to support our community. So go take a look at those businesses.
Absolutely. I think we need to figure out some sort of like an official
I think we
declaration
do.
as the
I think
chicken
we're getting
capital of
close.
Connecticut. I don't know. We got a
Per
basketball
capita
chick,
is like
maybe.
really creepy.
Yeah, the governor can call us the basketball capital. We can be the chicken capital of Connecticut, I think. Very good. Any other questions from, or liaison or committee reports? Seeing none, we will move on to public participation again. If you're in the room and like to speak in public participation, please step up to the microphone and state your name and address for the record. If you're on Zoom, use the raise hand function and we will alternate. And we have one on Zoom. Go right ahead, Ms. Lyons.
Hi, Rose Lyons again, 46 Elton Drive. I just wanted to thank Deputy Mayor Rada for asking the question about the public hearing. I'm still not clear whether it's going to be renumbered a different ordinance number or not, but that can be discussed at another time. I'd also like to thank Councilor Ford, who in the past has reached out to me to offer to answer any questions I had about the committee. A hint, I don't answer my cell phone. Try the landline. I didn't notice that you called until about 2 weeks later. And the other thing, and I probably can go back to one of the devices I was using here. I'm watching on NCTV. I'm listening on the phone on Zoom, and I had the YouTube on. I could just barely hear what Lauren was saying, but I somehow picked up and you don't have to answer me. I'll try and go back that perhaps there's some other revisions or something that has to be made and reviewed, and there'll be a couple of more meetings before the actual vote will be taken. So I thank you for everything, and have a good night.
Thank you.
Thanks, Rose.
I think you got the proper gist of it too, Ms. Lyons. That was exactly pretty much it. There's still a few more things that need to be reviewed and a few more meetings to get it done.
And I'll try your landline.
Thank you.
All right. Anybody else in the room or over Zoom? Come on up.
You know, cast by bedtime, you know.
This is early for us. I don't know. I don't know what you're talking about.
On the TPZ, at least, you know, we kind of get out of here before we
Try.
you know, and maybe that's not a good sign. At any rate, Michael J. Fox, 1901 Main Street, Mr. Mayor, councilors, and town manager, thank you. All right, let me just, before I continue, I should have said this before. I'm not surprised about that rating that the fire department get. I mean, since 1979, I was about same day that Councilor Ratter, we fought our first fire together too.
Firefighter.
Oh, yeah, firefighter. Oh, yeah. At any rate, they are good. We've you know, always had a good rating. At any rate, as far as this, as the municipal vet rep is concerned, I mean, right now, what I'm talking about right now is just one person be on staff somehow, whether it be the town manager or beside, you or the town manager or whatever. And his or her job would be to get trained and to, be a liaison with the veteran service officers up at the VA, from the DAV and the American Legion. And they're all good. They do a good job of making sure that a veteran that has a claim gets that claim through And I think there's a good rate of approval as far as the claims are concerned. But I'm actually talking about a committee. I think I mentioned Carol a while ago. The last two charter revision committees, we have tried to change add to the charter a paragraph or whatever, kind of making a veterans committee, not the parade committee, but a committee that would made up of veterans, civilians, and of course, council liaisons. Can't get away from that. And as I said, they would be people that somebody like me or any veteran would go to if they have any questions about getting claims, because a lot of people are really reticent about going right up to the VA, because it really can be complicated, and it can be really daunting. Or even going, trying to find out how, for a young veteran or a veteran who maybe just came back from overseas somewhere and was discharged, and right away they're going to hear that the VA is a terrible place to get medical care, and so they would need some impetus to get their care. I'll do a little PR for them right now. Marie, she should rest in peace. Wouldn't go anywhere but the VA, and I get all my medical care from the VA, which is why I'm kind of worried right now. But so I would like to see a lot of young veterans, do the same thing. As I said, I couldn't get it past the charter revision committees. And so I don't know. I think it might, it just might be a dead issue now as far as that committee is concerned. But I would like to, talk to the town manager and get some ideas whether we can do it by ordinance. Because I know Berlin had put together an ordinance, and they have a committee of veterans and civilians and town council or the alderman liaisons, and well, they put together a bunch of money. They did some fundraising. They got this big area up by where is that? Near where the American Legion is there, not far from Farmington Avenue. It's a huge place, and that's where their veterans cemetery is, and it's terrific. I don't expect that, but I do expect. I would like to see a committee formed, and so I will put the bee in your bonnet, put the ball in your court, and hope you do better than the Yukon men did. And leave it to you. I'll be back, of course, and I'll give Heather a call during the week to give us both time to do some research. Okay, thank you very much for all you do.
Thank you, Mr. Wax.
You've got a hell of a smile tonight. What do you got going? I don't know, you were sitting there.
Appreciate it. Thank you.
Thanks,
Mike. Alrighty. Anybody else in the room or over Zoom that would like to speak in public participation? Seeing none, I'll move on to remarks by councilors. Any comments from councilors? Councilor Nagel.
Very briefly, I have several times made comments about the volume and being able to hear in this room. There have been some progress in terms of making the general hearing better in this room, which has aided me to some extent, and one or two other people have mentioned that. But also, as you may notice or not notice, I have a portable hearing device that has immensely improved the ability to hear and hear for me. And I've been informed that it is also, there's more than one, there's several of them, and the public, upon request, is able to use them. I don't think anybody should be embarrassed about that, and it's easy to adjust and whatever. So I appreciate what the town has done, and if anybody else here on the council is saying they can't hear, they can hear, but they really can't. There are some there for you as well. They work. Thank you.
Thank you, Counselor. Any other remarks? Counselor Floyd?
My phone does. It's just on that point. Thank you, Counselor Nagel, for mentioning that. I don't know, Jonathan, can you speak to how folks could go about requesting that if they're attending a meeting?
Actually, I would defer to Mr. Hoagland to answer that. I know that we have this one set. Do we have any others? We have 4 sets. Okay, so to the extent to which there's anybody hearing, listening to me tonight or listening to this discussion that's having trouble hearing, please contact me by email or phone, call the town manager's office, and we can make arrangements to make sure that you can use one of those devices when you, if and when you attend not just a council meeting, but any town public meeting.
Beautiful, thank you. And
But that is held in this room with the caveat.
And then just the other question was about, to Mr. Fox's points. I did a very crude search and I couldn't find anything about a municipal veterans representative. Is that something?
I don't know anything about it. I'm happy to talk with Mike and, report back about, what, if anything, we can do at the town level to support our veterans, as liaisons with the VA or anything else. I don't know. I'd have to do the research to understand it better.
Thank you, Jonathan.
Deputy Mayor Rada.
Yeah, I, just to speak a little bit to, the veterans rep. I did quite a bit of work a few years ago, working on a veterans project, with another health district. And I'm happy to look into it as well, because my understanding was that, I hate to say a requirement, but for municipalities, there was requested a veterans rep to be that liaison between the community and the VA. So I'm happy to do that. I know that Mike Fox and I were part of that original committee, advisory committee that Gary Turco put together. That may be something that we can incorporate into something broader for the veterans in our community. So I'm happy to work with you on that and anyone else that's interested.
Sure. Real quick. Well, yeah. That's probably better for offline, just because we have the rules, like you can't come up twice again, so like that's the rule. I have to follow the rules.
We'll talk.
We have the rules. We got you. We
Just
got
call
you.
me and we'll talk.
Yeah.
Yeah.
Just because I got this actually from one of these service officers.
Okay.
At the VA.
Okay. Okay, very good. We're on. Very good. Any other remarks by counselors? Seeing none. All right, we'll go on to informational items, the info items.
Good mayor.
Oh, we haven't done that yet.
Oh,
Don't worry about it.
never mind.
Jump the gun, thanks. That'll be enough for you. All I got is it's opening day on Thursday, so whether you root for the Yankees or one of the
Or
other
the
teams.
Phillies.
I don't know what that is.
Phillies.
Go Sox. One of the other teams. Don't worry about it.
Somebody.
Hope you enjoy spring and get outside and enjoy some of the nice weather. It starts to change. And
I know it was winter yesterday, so God knows what it is
today
today.
is a little hint of spring, so we'll see.
We need to practice so we can get that size 13 trophy.
Yes,
to
that
put in.
I will say I'm gonna be reaching out to you about a campaign because I want that trophy. All right, I will entertain a motion to adjourn. If no other comments. Motion by Councilor Flores, seconded by Councilor Gonzalez. Any discussion? Seeing none, all those in favor of adjourning? Aye. Any opposed? All right, motion carries unanimously. We are adjourned 8:52 PM. Great night, everybody.
Rolling.
Thank you.